Hey everyone, in this video I am going to talk about the antimicrobial agents that work by inhibiting the protein synthesis. All the protein synthesis inhibitors inhibit the translation step of the protein synthesis. The selectivity for the bacterial protein synthesis is caused by differences in the structure and function of the ribosomes in the prokaryotic versus eukaryotic organisms. So the bacterial ribosomes are 70S and they have the subunits 50S and 30S. And the eukaryotic ribosomes, they have 80S ribosomes and their subunits are 60S and 40S. Now in this class of antimicrobials, some drugs work on 30S subunit, for example aminoglycosides, tetracyclines and the glycyl cyclines, while other work on 50S subunits, for example amphenicols or the chloramphenicol, and macrolides, lincosamides, streptogramins, and oxalidinones. Now there's one more category, and it works by inhibiting the tRNA synthetase, and this includes the mupirocin. Now let's discuss them one by one. So first of all, we have the 30S inhibitors. In this group, we have the first drug, that is aminoglycosides. They bind to 30S and cause mRNA codon to be misread. They also interfere with the initiation complex formation. Now the drugs that are included in this category are streptomycin, gentamicin, neomycin, amikacin, tobramycin, and plazomycin. Their adverse effects includes these drugs are ototoxic and nephrotoxic. Now let's talk about the uses. So streptomycin is used for tuberculosis, tularemia, plague, and brucellosis. Then gentamicin, tobramycin, and amikacin, they are used for the gram-negative RORS infections, including the Pseudomonas aeruginosa. Then plazomycin is used for complicated urinary tract infections. Now let's discuss another class of 30S inhibitors. So the second class is tetracyclines and glycyl cyclines. They prevent binding of the tRNA to mRNA. Now let's discuss their use. The tetracyclines are drug of choice for most infections that are caused by Rickettsia and Borrelia species. For example, Rocky Mountain spotted fever and Lyme disease. They're also excellent for mycoplasma, pneumonia, chlamydia infections, and spirochetes. Now the tetracycline, which is a glycyl cycline, it is used for the skin infections which are caused by various gram-positive cocci and the intra-abdominal infections which are caused by various facultative and anaerobic bacteria. Now their adverse effects include they bind to tissues undergoing the calcification, for example the fetal teeth and bone tumor, so they are avoided in pregnancy and children under 8 years. Now let's discuss the drugs that are the inhibitors of 50S ribosomal subunits. Now I'm going to discuss the groups that are having the same function in this category first. So we have the macrolides, streptogramins, and the lincosamides. Lincosamides belong to the group clindamycin. Now all these drugs block the polypeptide exit tunnel on the 50S ribosomal subunit and prevent the peptide chain elongation. The examples of these groups are, first of all, in the macrolides we have azithromycin, clarithromycin, erythromycin, and in the streptogramins we have quinopristine and the delphopristine. Now let's discuss their uses. In macrolides, azithromycin and erythromycin are used for genital tract infections that are caused by chlamydia trachomatis, and clarithromycin is used mainly in the treatment of Helicobacter and Mycobacterium avium intercellulare. Then the clindamycin is used against the anaerobes such as the Clostridium perfringens and the B. fragilis. Then streptogramins is used in the bacteremia that is caused by vancomycin-resistant Enterococcus faecium. Now let's discuss another group, that is amphenicols or the chloramphenicol. Chloramphenicol binds to 50S and inhibits the formation of peptide bond. Now the uses of the chloramphenicol includes the H. influenzae meningitis, typhoid fever, anaerobic infections, especially the B. fragilis. The adverse effects includes bone marrow toxicity and the gray baby syndrome. The gray baby syndrome results from the inability of the infant's immature liver to metabolize the chloramphenicol. So this results in abdominal distension and cyanosis, and that can lead to death. Now let's discuss another group, that is oxazolidinones, and it includes linezolid and the tedizolid. They bind to 50S and prevent the formation of ribosomal complex. Their uses includes the vancomycin-resistant enterococci, methicillin-resistant Staph aureus, Staphylococcus epidermidis, and penicillin-resistant pneumococci. Now their adverse effects includes the GI upset, headache, peripheral neuropathy, and thrombocytopenia. Now let's discuss the last category of the protein synthesis inhibitors, that is the tRNA synthetase inhibitors. In this class, we have the mupirocin. It inhibits the tRNA synthetase, which is an enzyme that attaches the appropriate amino acid onto its corresponding tRNA. And the uses includes the skin infection caused by the strep pyogenes and the Staph aureus. So that was all about the protein synthesis inhibitors. Thanks for watching.